I'm Dr. Jennifer Yu. I'm one of the Interventional Cardiology Fellows at Mount Sinai Medical Center, and on behalf of my co-investigators, I'm very excited today to present our study, a novel approach to identify women with cardiovascular risk factors. These are results from the Women's Heart Health Initiative, which was an OB/GYN screening pilot program. So the background to this study is that cardiovascular disease is a very important cause of morbidity and mortality in women worldwide. However, many women have this preconception that heart disease is primarily a disease of men, and many women don't have a primary healthcare provider. So we felt that this was a really great opportunity to have a look at the spectrum of women from an OB/GYN perspective, looking specifically at the prevalence of cardiovascular risks and symptoms. So basically, we implemented, this is a pilot program, a screening tool was implemented in 17 centres throughout the United States. And so women presenting to these OB/GYN clinics were asked to fill out a survey which basically asked questions regarding traditional cardiovascular risk factors, also known cardiovascular risk factors that are particular to women, such as gestational risks like gestational diabetes and preeclampsia. These are our results in the first 2,234 patients that were screened. So what we found were that in this population we had an enriched population in terms of postmenopausal women and 27% on HRT, as you can see there. And looking at the age groups, really the majority of our patients were aged, you can see just over half were actually aged above 50 and a good proportion in their 40s. In terms of their cardiovascular risk factors, really interestingly, we found that the traditional risks in these patients presenting to community OB/GYN clinics, really quite a well population, was very high at 68.5%. And then when we added on top of that additional risks, known risks such as being overweight, sedentary, and very important in this population, prevalence of gestational diabetes, hypertension, preeclampsia, we actually found that 87% of women had any one of these cardiovascular risk factors. We also took a look at patients who are unaware of their risk factors at time of screening. So really interestingly, we found that a very high proportion of people were actually unaware of very common risks such as diabetes and hypercholesterolemia. People didn't know their blood pressure, and the majority of these women are aged above 40, so that was very interesting. In terms of cardiovascular symptoms, you can see that, again, a very high proportion of these patients, over 40%, reported some sort of potentially cardiac ischemic symptoms such as chest pain or palpitations or claudications, which is a symptom of peripheral vascular disease. Really interestingly, we then looked at this population by who these women considered their primary care provider to be. And we found that 18% of the women screened considered their OB/GYN their primary care provider. About 3/4 of the women had an additional primary care provider who was not their OB/GYN, and just over 5% felt that they had no primary care provider at all. And when we looked at the data this way, it was very interesting to see that the proportion of patients who weren't aware of their risk factors for cardiovascular disease, and these are very common, well-known cardiovascular risks such as diabetes and high blood pressure, being overweight or having high cholesterol, was exceedingly high in patients who had basically either no primary care provider or had an OB/GYN primary care provider as compared to somebody who had a primary care provider outside that field. So I think the real message of our study is that by screening these patients in an OB/GYN community clinic, we have a really great opportunity to identify additional patients who are at risk, and that this may enhance the delivery of primary cardiovascular prevention and education to these female patients at an earlier point in time where we can really make a big difference. There was a screening form that was designed in collaboration with Sky Win, who are the Women in Innovations chapter of the Society of Cardiovascular Interventions. So the first section covered traditional risk factors, such as, do you know if you have a high blood pressure, and have you had your blood sugar screened? So very simple questions. So when women present to their OB/GYN clinics, they first completed a very simple one-page screening form, often with a nurse practitioner before they had their OBGYN appointment, or sometimes with the OBGYN themselves, so that those results were available then for the OBGYN. Often it was discussed, the results were discussed with the patient presenting, and we also took a look at how many referrals then came about among the patients who were screened. And we actually found that 1/4 of the patients screened were actually then referred to another specialist or primary care physician as a result of this screening tool, whether it be a cardiologist or an endocrinologist, because of some concern about, symptoms that were unaddressed or risk factors that were unaddressed.